Right in between here, basically between C1 and C7, like just the whole cervical spine.
I love educated patients.
Yeah.
All out. Good. Relax.
Oh.
Might be a little bit cold. Yes, I did just tell you after I put it on you. You okay?
Yeah, I'm good.
Remember, my name is Phil and I'm soft.
Yeah.
Okay, that's how you stop this.
Good.
Okay, good.
Oh, it hurts so good.
Phil.
Hey, nice to meet you.
Good to meet you. So, Phil was referred in by his girlfriend, and he's an avid rock climber. He's a gamer. He's a really interesting guy all around.
Thank you.
At least I found on my brief meeting of him. So right now he's in for, I believe it's some neck pains and some reoccurring like lower back spasms on laying down. I'm going to let him kind of take us through exactly what discomforts he's been dealing with.
Sure.
So Phil, do you mind sharing with us?
Not at all.
Yeah.
So, yeah, as you said, I'm a rock climber. So a lot of the time I spent my time just looking up like this, right?
Where's
so,
the next grip?
Yeah. Exactly. So I find my neck gets pretty stiff after a long period of time, even after the workout as well.
Yeah.
And in terms of my lower back, there are just times where my QL will just cramp up sometimes, and I just have to shimmy around a little bit, get some cracks and pops, and eventually they'll feel fine. So, yeah, I'm just over here.
I always love having patients when they start using terms like QL, okay, because that shows that they have a knowledge of the anatomy and the way that their body works. Phil, are you in school to be a physio right now?
So at the moment, I'm in kinesiology.
Okay,
I'm finishing my undergrad this year,
okay,
which is lovely.
That's exciting.
Very exciting.
Done part one.
Yeah,
Okay.
and then part two is going to come around for physio. Do my 2 years of master's wherever.
Have you applied yet to different schools?
Applications start very soon.
Okay, so that's exciting. My fingers are crossed.
Yeah, thank you.
Okay, best of luck. Physio is a very, very competitive program.
Yeah, I know.
But yeah, I love having patients who are educated on their bodies. They do a lot better as compared to the patients who unfortunately are not as educated. So the best advice I can give you, if you're watching and you have a complaint, learn about it. The more you learn about it, the more you learn correct information about it, beware what you're reading on the internet, the better your prognosis, which is the term for how you're going to do. Okay, so that's the first little nugget of information there for you guys. Okay, so when was the last time you rock climbed most recently?
I'm pretty sure that was actually last week, and I partially tore my one of my tendons.
Oh, that's super fun. Okay, so that's in the right hand there?
Yeah, it's my right hand.
So what's the movement you're having trouble with there?
So, I mean, there's no big troubles right now, but I was working on what's called a pocket climb.
Okay.
So the holes are just big enough to fit 2 fingers.
That sounds absolutely awful.
And as I was going for a hold, I basically had to throw myself with 2 fingers, catch myself with 2 fingers, and I caught myself kind of with my middle finger caught underneath my 2 fingers. So when I pulled hard through, I just heard 3 pops here.
Great.
And it was hard for me. I felt very weak when I was going to finger flexion.
Okay.
But now
how's it feeling now? Is it feeling like
feeling
you're back to it? Kind of?
It's like 80%.
Okay. What have you been doing for it?
Nothing. I've just been doing some like wrist flexion exercises. Been also strengthening extensors.
Been doing nothing. Guy's been doing rehab. So that's not nothing. That's important. Okay. So you've been doing exactly what you need to do for that kind of tendinous injury.
Yeah.
Tendon injury rehab's going to be your go-to.
Yeah.
So I'm happy to hear, again, knowledgeable, able to kind of self-treat a little bit there, but sorry to hear that happened.
It is what it is, man.
Literally, the injury made me shiver because that sounds absolutely terrible to me. I hate my fingers. Yeah,
it hurts so bad.
But the good news is pain's coming down, function's improving, so great news there. So I guess if you got that under control, we'll kind of stick to the neck and the back for today.
Sounds good.
What we're going to do today is we're going to do a physical exam. Well, that was the last time you climbed, rather. Are you feeling the neck tension right now, or the lower back tension right now?
A little bit in the neck right now. Lower back's feeling fine.
It's okay right now? Okay.
Yeah.
Now with that neck, is that the left side, the right side, or is it both sides?
I'd say it's both sides, right in the middle.
Dead smack middle.
Smack dab in the middle.
All right. Yeah, so again, if you're rock climbing, you're going to be using a lot of your traps likely to pull yourself upward, reach up, pull. You do that long enough, you crane your neck back enough, eventually you're going to get some stiffness, right? That doesn't mean it's bad for you. Pain isn't an indicator of something being bad. Just means you could be overloading something, all right? Which isn't, it's part of life.
Okay.
All right, so what we're going to do today is we'll do a physical exam,
okay?
And we'll see what we can do to treat you best and hopefully get you into neck extension or get you exercising with a little bit more comfort, a little bit less pain, all right?
Love it.
Perfect. So Phil, bring both arms up for me. Keep them there. Don't let me move them. Fight, fight, fight. Good. Fight, fight, fight. Good. Arms forward. Curl the wrists backward, please. Fight, fight. Nice. Fight, fight. This guy is strong. This guy is really strong. He's got like probably tank forearms. He's a climber. Yeah, of course you're going to have tank forearms if you're a climber. And you should turn over, curl the wrists backward, please. Oh my God. All right. Fingers curled, please. Now this might be a little tender on this side, but you just tell me, is that provoking the pain for you or not really?
Not really.
No? Okay, good. So he is healing, he is rehabbing that properly. If me challenging those insulted tendons isn't hurting him after 2 weeks, that's a really good sign. And pull, good, pull, good, pull. Nice turnover, fingers straight. Please gently squeeze mine, gentle, because you could definitely break them with how strong those forearms are. Good job. And we'll do the reflexes. So relax that arm right there for me as best you can. Okay, that's an obvious one. And drop the arm right there. Drop. Once again. There we go. Bring this arm back. Drop. Good. Relax there. Good and good. Okay. So he's a little bit reduced on our first deep tendon reflex there, but otherwise that looks like a normal neuro. All right, I'm going to get you to push this leg up into my hand as hard as you can. Good, nice and strong. Same deal with this side. Good, nice and strong. Toes up into my hand, please. Good. Toes up into my hand, please. Good. Let's take this. You just relax those legs as much as you can and try to do a backhand neuro. This is kind of tricky to do from this angle. There's a little one. You get little ones there, but not much with you. Relax this foot as best you can, please. Good, and relax. Good. I'm going to try one more time. Okay, right direction there. Okay, do me a favor. With your hands, I want you to pull them as hard as you can, okay? Pull your fingers as hard as you can. Good. Wow. You have no lower limb reflex there. Okay.
Super hypo-reflexive. Like,
yeah, so,
disgusting.
okay. Hypo-reflexive means low reflexes. So this is actually the first time to see that. But here's the thing. It's equal bilaterally, okay? It's not like one side is super active and the other side is completely absent. And we don't do we have any lower limb symptoms going on for you? No numbness, no tingling, no burning sensation? Nope. Okay. Then this is one of those situations where, yes, we'd say that the reflex is essentially absent, but I'm actually very tempted to call this his normal and not anything to be concerned about. So this is a great example of a patient who doesn't fit the primary mold, but everything's still fine. It's also why you probably shouldn't rely on the internet, because the internet will tell you that this is a big problem, but it's not. It's his normal. So Phil's getting a lot of middle neck pain. All right, kind of dead center. He was strong. Can you point to me where you feel it predominantly?
Honestly, it's like right in between here, basically between C1 and C7, like just the whole cervical spine.
I love educated patients. Yeah. So he's pointing. He's taking two fingers, right? He's placing one at the very top of his neck, and the other one is essentially right at the base of the neck, near that C7 prominence area. So he's saying it's stiff everywhere. Which honestly, if you're craning up and straining all the muscles to pull yourself higher, yeah, that kind of fits the bill. Yeah. All right, and you're feeling that on both sides, you said, not just one?
Yes,
okay.
Sir.
All right, so let's start with the range of motion exam. So first things first, let's do flexion. You need to bring your chin down to your chest for me. Does that provoke the stiffness or the strain back here at all?
I could feel a stretch for sure.
You feel a stretch, and that's probably down this way.
That's exactly
if I do something kind of mean, that is some conditioned hair. That's very, very soft. If I push your chin forward, is that better or worse or the same?
Super tight.
Super
way
tight.
Worse.
Okay, way worse. I'll get you to look up towards the ceiling for me, okay? How's that back here?
Honestly, that's also pretty tight.
It's also pretty tight. Now again, I'm going to do something mean, pull it further. That sucks, eh?
Yeah.
Okay. He doesn't like that, all right? And that is the extension movement that he's doing when he's climbing. Granted, I'm being mean and I'm doing something called passive range of motion where I'm pulling it even further, but we should, under normal circumstances, have that movement available to us and not cause an amount of pain like we just got there. So we'll see what we can do with that. I'll get you to rotate your head as far as you can to the right, please. And we're able to get to about 50 degrees. Now rotate as far as you can to the left. We're able to get to about 50 degrees. So we're equal there, but we're reduced on both sides. All right, 45 is like the cutoff for normal. 50 is still kind of low, but it is what it is. Maybe he's got really juicy traps. I'll get you to tilt the right ear to the right shoulder for me. That we're able to get to 45, so that's okay. Here, left to left. When we get to 45, that's okay too. So the lateral flexion is okay on both sides there. I'll get you to give yourself a tight hug. And now rotate as far as you can to the left, please. Here we got pretty good thoracic mobility. We're able to get to 80 degrees to the left. Now let's rotate to the right. and 85 on the right. So his thoracic mobility is really good. That's actually really interesting to see, given that he's having the neck discomforts. Typically, if we have a neck issue, the areas above and below will always overcompensate. So to see that the mobility is preserved in the thoracic spine, very, very good news there.
Nice.
Now, regarding the lower back, I'll get you to stand up for me, please.
Sure.
Could you please try to bend down, touch your toes? Does that provoke any of the low back stiffness at all for you?
No, nothing.
No,
there.
awesome. Now come back up the other way. I'm going to ask that you extend backwards. How's that?
Lower back.
Lower. So you're.
Oh yeah.
What did you feel there? Sorry.
It was just as soon as I'm here, a lot of tightness in the lower back.
Okay. And can you
area.
point to that for me?
It's pretty much this whole area.
So again, he's pointing to the muscular area of his lower back. We're looking at the QL, quadratus lumborum. You guys are very, very familiar with that by now, but we'll probably throw a diagram up there anyways, probably right there. Yeah, that's where there's space on the camera. Nice. All right, so we'll get you laying face up next. So Phil's mentioning that he does get some discomfort in his lower back, the QL specifically, when what typically aggravates it for you? I know that extension was really uncomfortable,
extension was definitely uncomfortable.
Are there any other movements you find that typically provoke that discomfort?
I find if I'm just like lying down,
on your back or on your front?
Like on my back.
All right. Are you comfortable in this position?
This is position,
Okay.
but the position I'm talking more about is sort of like a banana shape. Because like
banana, like an extension. So
like no, if I was like in flexion of the spine and I was sitting like a banana, yeah. Because when I'm gaming, that's usually my position.
Okay, so you're talking about like when you're sitting down and like leaning forward.
Yes.
Type deal. That's when you start to feel lower back discomfort.
Well, I'm not even sitting down. I'm lying down in bed and I'm like this.
Okay.
And I'm gaming like this.
That's, you know what, that's what I needed to show, because to be totally frank, I've never heard anybody ever describe it as a banana position before.
It's a banana.
So, I get it now. It makes a lot of sense to me. But initially I was like, what? Okay, so, yeah. Banana positions aggravate the lower back rim too. And that makes sense because if we are in a little bit of flexion there, we are stretching out that QL and then we're maintaining that stretch for probably longer than most muscles would appreciate. Yeah. So, anyways, let's get into the ortho exam here. So I'm going to start by bringing this leg straight up as high as it will go. And let me know if you get any pain to your lower back with this.
Okay.
No, anything?
No, nothing.
No? We can get up to 90. That's the normal range. I'll get you to slowly lower this guy down yourself now. Slowly lower him. Again, as you lower, let me know if you get any discomfort in that lower back at all.
No discomfort, no pain.
Love it.
All
Okay.
as well.
So we're going to go ahead and bring this up to 90 once again. Look at that. Well done. You get probably some tightness in the hamstring.
I'm super tight.
But that's very normal, especially as we get to 90 degrees. So go ahead, lower it down. Let me know if you get any lower back discomfort. So as he's lowering down his leg here, what he's doing, or what we're doing, is we're eccentrically challenging that QL muscle. Eccentric means we're applying a force as the muscle lengthens. So in this case, we're making sure that that descent is very, very controlled. Any low back pain with that?
No pain.
Eccentric movements are the most muscular intensive movement we can do. It does do the most damage to a muscle. And if that's not provoking it, that tells me that this is a pretty healthy back, okay? And it just happens to be there are some positions that seem to aggravate. Let's go ahead and gonna bend this knee and put my hand behind your hip here and push on through. Anything there, that's okay?
That's okay.
Perfect. And we're gonna do the same thing on this side. Bring this up, tilt over, and push on through. That's okay?
That's okay.
Love that. Okay, good stuff. So overall, normal lower limb lumbar spine ortho exam. That's what I meant to say. Perfect. All right, so once again, Phil is dealing with some occasional QL stiffness, and that's provoked in extension-based movements or the banana movement of, laying down and gaming for prolonged hours, which I totally empathize with. And then also up into the neck complaint. So anytime we get a neck complaint or anytime we get a complaint anywhere along the spine, anywhere along the body, it's always a good form to check both above and below that, right? So given that this is primarily a neck complaint, we're going to be checking his upper back. Given that right above his lumbar spine, where he does get discomfort, is also our upper back, we're going to just screen everything here, all right? So starting at the base, we're going to start with the SI joints. The sacrum is the bottom of the spine. It connects into the iliums, which are the hip bones. The SI joints, the sacroiliac joints, connect those two. Going to press in through there, press in through there. That doesn't provoke your pain, does it?
No, it does
Didn't
not.
think so. Okay, now we're going to go ahead and climb up. And we're working through, you'll notice I'm actually not very close to the spine this time around. Spine's here. I'm actually coming further out to screen the QLs and the muscle itself, because that's where he tells me he's most sore. Now I can hear him kind of gasping. Is that a tender spot for you there,
Oh my
sir?
god, yeah.
Yeah, okay. So this is fun because for patients that I don't like, I can press real hard in there, and then they start to cry. But I kind of like Phil, so I'm going to give him a little bit of a breather there. I'm going to work my way up. And upper back actually feels pretty good, all things considered. Are you left or right-handed?
Right-handed.
Right-handed, okay.
But weirdly enough, my left side has been getting stronger.
Your left side's been getting stronger.
Yeah.
It's not necessarily a bad thing.
I think I've been abusing my right side.
Okay, so I think I feel a little bit in his upper back, but there's really not that much. We're going to try for it anyways. So we're going to adjust you, okay? So we're going to start with the upper back. Phil has never seen a chiropractor before,
No.
okay? So this is going to be his first adjustment. Usually I like to do the upper back first because it's the least, I'll use the term shocking for people who've never done this kind of thing before. So all it's going to be, well, first off, the first time you adjust somebody, it's actually not possible to know how much force is needed in order for them to go, all right? I've had like 300-pound dudes on this table who I could basically sneeze on and they would release. I've had 100-pound ballerinas who I would have to all but quite literally body slam for anything to move. So I'm going to start light, and then I'm going to gradually add more and more pressure. I'm not going to sneeze on you because that's gross. I'm not going to body slam you because that's negligent. But we're going to start light and then gradually add more pressure if necessary, okay?
Okay.
What I'm going to need from you is I'm going to need you to take a big breath in and then to get it all out. All out, all out. Good. In. All the way out. All out. Good. There we go. That was a good one. Did you feel that?
Oh, yeah.
I'd hope so. Good. And just breathe normally now for me, okay?
Okay.
So that was quite crunchy. There was quite a bit there in the upper T-spine. I think the mic would have gotten that one. One more. Big breath in. And all the way out fast. All the way out fast. Good. Okay, no, nothing there. That's okay. And that feels okay to me too. All right. You don't get any pain into the glutes or the lower limbs at all?
No, sir.
Oh, perfect. Okay. Then next up, what I'm going to get you to do is I'm going to get you to actually lay on your the lower back. Both sides appear about equal for you in terms of the discomfort, huh?
Yeah.
Okay. One leg's going to be straight. Top one's going to be bent. Nice. You're going to pull the hips towards me. Thank you. And I promise you're not going to fall off. Okay?
Okay.
Yeah. Haven't had anybody fall off this table yet. I don't want the first one to be on camera. So what I'm going to do is I'm going to get you to take a big breath in. Once again, all the way out. And I'm going to roll you towards me, and you just relax. Good job.
That felt good.
That felt good?
That was great. Man.
Love that. Let's get you on the other side. Good stuff. Hips towards, a little closer to me. Thank you. Put that back there. And hold it right there. Breath in. All the way out. Relax for me.
Oh, nice.
That was even better than the other one.
So good.
I'm glad you like.
Nice.
Oh, good stuff. So Phil has been dealing with this neck discomfort for how long have you had this been going on for?
Probably, I don't know, a year now.
Year, about a year.
Yeah.
Okay. Have you done anything for it other than try to like exercise it or stretch it out yourself?
Yeah,
Not
just
really?
like rehabbing, like just like training my flexors, my extensors, like trying to loosen up like, the neck area.
And obviously that's helped to a degree, I'd hope.
A little bit, yeah.
So, you know, there's I get a lot of people who, I'm in healthcare, obviously. I see a lot of patients, and all of them do get exercise, typically, for their conditions. Why? Because I'm in a gym. I'm very big on the weight training and the exercise rehab components. But there are some times where exercise is only going to get you so far, and you need some form of manual therapy to help push through a barrier of some sort, right? So that can be massage, that can be adjusting, that can be mobilizations, which is what osteopaths do a lot of. So all in all, like, you can argue, oh, well, the evidence supports exercise, and yes, you're correct. We should absolutely be including manual therapy in patients who've been doing exercises but appear to plateau in their complaint. So anyways, let's get into this here. We're going to start with the right side, okay? So are you nervous all about having your neck adjusted today, or?
Well, a little bit.
Okay.
Can't lie.
The best thing that you can do is to just stress out about it. Okay. The more you freak out, the smoother it goes for everyone.
That's exactly what I'll do.
Perfect. Perfect.
Oh my god.
Oh my god. That's a joke, guys. Relax. Okay. So I do need 2 things from you.
Okay.
To get this to go. Okay. So the first thing I need from you is to turn your head as far as you can to the left, and then relax it into my hand. Good. Now, that's the first thing. The second thing that I need from you is to not know that I'm about to do it.
Oh.
So there's a little subtle one right there.
I like that.
I'm glad.
Let's try that again.
I will. I'm going to actually try that a different way.
Yeah.
I'm going to get you to turn your head as far as you can to the right. Drop, drop. And this is still for the right side, what I'm about to do. Okay? So just relax there. Okay, so there was one there, but my foot or my knee nudged this, so I don't know if the camera got it or not. But still. Now let's do the left side. So for those who are curious, the first adjustment got probably, I'd say from C2 down. There were quite a few, maybe 2 down till about 4 or 5. The second one with him facing to the right and take my hand like this. I don't do that one very often on camera, but that's for his occipital region. That's the CO, C1, basically between the skull and the atlas, the top vertebrae. So that's for the difference in technique there, if anybody's curious. Turn to the right, good, and drop the head into my hand, good, and relax it, nice, relax it. Oh no, I nudged the camera, but we got it.
Oh,
Good job.
that was a big crack.
Yes, it was. Good job, dude. How does that feel right now?
Feels really nice, actually.
I'm very happy to hear that. So next up, we're going to proceed with some more soft tissue work.
Okay.
All right, so for today, we're going to be doing our usual instrument-assisted soft tissue therapy. We're going to be focusing on these QLs for certain because they appear to be way more tender than he realized, but that's why I have job security. I come around and poke something and go, see that? It's not supposed to feel like that. And we'll also, of course, work up into the trap region too. So let's get started by putting on some of the gel that we need to use. This might be a little bit cold. Yes, I did just tell you after I put it on you.
That's good. That's smart. That's good.
I like to surprise people like that, keep them on their toes. And then because I like to sit down and work, I'm going to wheel my stool over here. So, all right. Now, as I'm doing this on my patients, I usually like to give them a chance to share something about themselves, so the audience has a chance to connect with them, and they have a chance to connect with the audience, vice versa. So, a question I'm going to ask you today, Phil, is what you do for work, okay, and B, what you find rewarding about that job. If hopefully you do find your work rewarding. I assume that you do.
Yeah, no, I find my work pretty rewarding.
Okay,
so
good.
I'm a coach at a fitness center in Bradford.
Okay.
I also am a class instructor and a personal trainer.
Love that. Okay.
And honestly, I love it, man. I love it.
So if I can ask why it is, like what the most rewarding aspect is, I think I know what it would be, but I still want to hear it from your mouth. Mm-hmm.
I think most of it really comes from the personal training side of things and being able to actually have a personal impact on somebody's life, right? And it's through health and fitness, which has benefits that will long surpass the 24 hours that will pass by, right?
Of course.
So I think it's really fulfilling seeing how much benefits actually come out of that and how I'm able to provide that for them too. It's a good feeling, man. And I mean, it sounds a little selfish, sure, a little bit in vain, but in all honesty, it's how I feel.
It doesn't sound in vain at all. You could argue that some people only work out for their physique, and okay, by definition, that's vain.
Yeah.
But as somebody who used to only work out for his physique, that's how it starts, right? I mean, nobody ever really gets into health and fitness just for health and fitness, right? It usually starts for some extraneous reason, and then over time, it morphs into just kind of what the health and fitness only that, right? What you're saying in terms of being able to help people reach their goals and decrease their pains, yeah, man, that's kind of why I'm in chiropractic. So I completely get that. Good on you for doing that, because in my opinion, you're already in healthcare. Okay, you're already one of us. You're helping along the track, and you're being very preventative with your methods, which of course I'm also huge on. So thank you for enjoying your work.
Yeah, no, it's awesome.
I look forward to the days of you being a physiotherapist and I have somebody to refer to.
Oh, those are going to be great days.
Those are going to be
I'm also
awesome
excited
days.
for those.
Yeah. Can't wait to send you the patients who like just complain too much.
Yeah.
You know, you can take them all. I'm kidding. None of you guys complain too much.
Trust me, they won't stop complaining.
No, I know, and I don't blame them. If I had knee pain for like 30 years, I'd be complaining a lot too. So.
Yeah, exactly.
Yeah. Now, if at any point in time what I'm doing here is too tender on you or it hurts too much, just suck it up, okay?
Oh, I'm sucking it up
Perfect,
right now.
perfect. Love that. Yeah, I'm kidding. You tell me to stop, but all the same.
No, keep going. You're good.
Love it. So we are definitely getting quite a bit of that petechiae on his back here. It's kind of tough to see from that angle, but we do have a lot of that redness forming here. Again, totally normal, indicative of fascial adhesions now released. You guys are probably pretty familiar with that by now. And if you're unfamiliar with fascia, I'll run you through it after this, okay? How's that right in there? Yeah, that's the spot, eh? Yeah, it's a safe space. You can swear away if you have to.
Oh,
it's fine.
yeah?
Yeah, you're okay. Yeah, don't
Okay,
worry.
good.
Yeah. We're past the initial 15 seconds of non-swearing that YouTube mandates in order to be monetized, so go ahead. Swear away. We're home free. Yeah. Mm-hmm.
Oh, cause that spot's fucked right now.
Okay.
Super loaded. Oh my god.
Oh, yeah.
Yeah, actually, I came back from a backpacking trip last week.
Oh, boy. Okay.
My upper back was just so
Shot,
knotted.
eh?
It was shot.
Ah, you should have come in last week, man.
It was fucked.
It's okay. Better to have you now.
Yeah. This feels phenomenal.
You like this,
Okay,
Good.
fine.
That didn't even sound like sarcasm, so
No.
I'm tempted to actually believe you when
No,
you say
no,
that.
no.
Perfect.
It's awesome.
Yeah, this is really working into that left scap area that a lot of climbers and, well, athletes and also desk workers all struggle with, so. Wonder out of curiosity, how are you in the? Are you ticklish or are you tender in the lats?
Tender.
Tender?
Yeah.
Okay, yeah. Climber. Lats are a big climbing muscle. They're how we do our pull-up movement, so I'd imagine that on him he'd be quite tender for those.
I know it's pretty sore. I worked out yesterday.
Yeah. I will not scrape them for you then. If it's just DOMs, that's gonna make you absolutely cry. That's not worth it. Yeah, if it's reoccurring stiffnesses, no, we can do this, no problem. But
So I don't mind explaining a little bit.
also, the lats are one of the most sensitive areas to work from a scraping position or a scraping perspective, rather. So yeah, fully. If you want to, we can, but I'm not gonna force that on you. You be the decider of your own fate there. Okay.
This is because it's something I haven't experienced.
Yeah.
I really want to try it.
You want to try it?
I'm down.
All right, we're gonna do it. Okay. More content. Let's
Even
do it.
if it's super painful,
Mhm.
I'm in.
Perfect. I love that attitude. I need 10 more people like you.
Yeah.
Mm.
Was that you that just cracked? Was it?
That was me. Yes. So because we're doing the lats, we'll finish up with the back now, and then we'll reposition you and do them one at a time. Okay.
Let's do it.
Right. So as we know, Phil is a climber, and probably one of the most predominant muscles that climbers use is their lats. All right, we can put a diagram of the lats up over there, but they connect basically from the bottom of our back, our lower back, come on up and actually insert into our humerus, which is our arm bone up here. All right, so they are very sensitive areas on the average person, but if you can imagine somebody who uses them every day recreationally, they're probably going to be a hell of a lot worse. So we're going to start off and hope that this doesn't hurt too much. But I love that we're doing it with his face facing the camera first so we can get authentic laughter. That's not what I was expecting, but we'll see what happens in about 5 minutes.
That's
here.
my reaction to pain.
Okay, good. We're going to get along, buddy. Like that's yeah. Don't worry, this is just the spread the gel around tool too, alright? It's not even
it's not even the freaking thing.
No, this isn't the do work tool.
Oh,
nope.
for fuck's sake.
Oh my god. Okay, I'll take this. Here we go. Yeah, we're already getting that petechial redness here. And again, you guys can't see this on camera here. Maybe I'll move the camera before he does just so you can see exactly what we're doing. But yeah. Now the magic word to get me to stop this is my name is Phil and I'm soft. Okay, that's what you need to say to get me to stop doing this right now.
Okay.
Yeah.
That's never going to come out of my mouth.
Good job, buddy. I'm afraid I'm going to give you back to your girlfriend and she's going to go, what the hell happened to you? Because she doesn't get this red when I do this to her. So, yeah.
Ooh.
So this point right up here, this is right where the lat inserts into the humerus, in the arm bone there. So it's anticipated that we're going to get quite a bit of redness right there. And lo and behold, yes we do. So, buddy.
Oh,
I'm glad I met you today. Yeah. All right, so I'm actually going to leave it right there, but I'm going to move the camera so that you guys can see exactly how much is there. Give me a second here. Yeah, you just sit tight right there for us, okay? Yeah, there we go. So that's quite a good deal of redness there, and that was 2 minutes of scraping, not even. So on somebody who's constantly engaging his lats, constantly using them like a climber, definitely a beneficial thing to do. All right, now we're gonna do the other side for you. Gonna have to do it from this angle this time around, but all good. Okay. So we were pretty red on his left lat. Let's see what happens on his right lat, which coincidentally is also his side of dominance. So let's go ahead and get started here. And you're getting right started with the working tool, okay? This isn't the spread it around.
Okay. I thought it felt worse off the rip.
Yeah. You guys hear that sound? Yeah. Now you can't see his face from there, but he is smiling. I promise you guys, he's laughing now. He is smiling. Jeez. You okay?
Yeah, I'm good.
Remember, my name is Phil and I'm soft.
Yeah.
Okay, that's how you stop this.
Good.
Okay, good.
It hurts so good.
Better than hurts so bad. Good stuff, buddy. All right. Good job.
Okay.
I'll get you to just tilt that way. Yeah, there we go. Okay, so now that's a very good angle for the camera to see. Again, you got a lot up in the muscle belly here, and it does decrease down as we come down in towards the spine area. But that's really good job. Really good job, buddy. How was that?
That was, as painful as it was, I actually felt decent.
Yeah, you're allowed to say that it sucked.
It
That's
sucked.
fine. Okay, you're allowed to say
It sucked
that.
so bad.
But hey, you know what? The lats, again, like I've said before, are probably one of the most sensitive areas to actually scrape. And you handled it like a champ. Genuinely, I mean that. Okay, you did phenomenal. We're going to do a little bit more massage therapy to fill those upper traps here because they're still feeling a wee bit ropey. It's also a little bit difficult to actually scrape them from that angle. It's a lot better to do with them sitting up, but we've already scraped the crap out of them, so I kind of want to give them a bit of a break from that. So instead, we're going to be doing MRT. So I'm going to get you to start by looking up and to the right for me, please. Now I'm going to take my pointy elbow. You guys can, wow, actually you can really see that on camera. That's
Very pointy.
Yeah, okay. I'm going to go ahead and put that right there. Now I'm going to get you to slowly look down and to the left, okay? Go look at the chair legs over there. Good. Awesome. Now we should look up and to the right, and we're going to just repeat that, okay? Good. Up to right, down to left. Up to right, to left. You're doing great.
Oh my god.
And once again, up to right, down to left.
Oh, that one sucks.
That was
Oh.
okay. You know what? We're gonna do that 2 more times.
Oh, you're
Sorry
okay.
about that.
No, it's okay.
Up to right, down to left.
Fuck. Oh, fuck.
Up to right, and down to left.
Oh.
Good job, buddy.
Oh.
Okay, good. So that's for the levator scap.
Oh.
Okay, now we're gonna do the upper traps.
Oh my
The upper traps, we're gonna face forward. We're gonna tilt our right ear to our right shoulder.
Okay.
And now we're going to slowly tilt our left ear to our left shoulder. Go ahead. Good. Right to right. Left to left.
Fuck.
Right to right. Left to left. Good. And right to right. Left to left. Oh, man.
Ah.
Oh, buddy.
Oh.
Okay. Bad news, we have 2 sides.
Oh,
so
I
you
know.
should look up and to the left for me.
Oh.
Good. And down and to the right, please.
Oh my god, I felt that last one in my brain.
Probably. And down to the right. This side isn't as bad?
Not as
is-
bad.
Okay, good. Down to right.
Maybe I'm cheating myself a bit too.
I'm pressing just as hard, so.
I might not be looking
Right.
this way.
And one more. Down to right. Good. Face forward. Tilt left ear to left shoulder. And tilt right ear to right. Good. Left to left. Right to right. Left to left. Right to right. Left to left. Right to right. And left to left. Right to right. Good job, buddy. All right, shrug the shoulders up into my hands. Good. Now slowly lower them. Slowly lower them. Good. Up, up, up. Slowly lower. Slowly lower. Good. And slowly lower. Yeah, bring up and slowly lower. I like how you do what I mean, not what I say. I love when patients know what I mean. It's great. All right. Good job. You have survived the treatment.
Nice.
Well done. Phil, how did you find... Well, we did quite a deal more scraping than I thought we were going to do, especially in the lats. But how did you find everything that we kind of did today as our first chiro visit?
So at first chiro visit, wasn't really sure what to expect.
Mhm.
I was definitely expecting some sort of discomfort for
Yeah.
sure, but holy like having you scraping my lats was
Mhm.
probably like one of the most painful things I've experienced in
Yeah.
a while.
Mhm.
But
Mhm.
it does feel a little more relieved.
Good.
It doesn't feel as tight.
Good.
Same goes for my neck. Same goes for lower back.
Mhm.
Lower back especially, I feel is very loose right now,
Mhm.
which I love.
Very happy to hear.
It's very
Yeah.
good. And neck, I could definitely feel like there's some feedback coming from it.
Mhm.
It feels warm, but I guess it's just because it's been worked on.
Yeah, warmth
But-
is a very common sensation
Yeah.
after what we do.
Yeah.
Mhm.
But overall, like, I don't feel tightness anywhere. No discomfort anywhere.
We like that.
All in all, pretty.
We love that.
Pretty
So
freaking good.
thank you for sharing that.
Yeah.
Scraping usually doesn't hurt that much. And in the back, yeah, it was probably sensitive, but like it wasn't nearly as bad as the lats, right?
Yeah.
Like I want to emphasize that the lats are a very sensitive area to be scraped with that therapy. So what he's saying about it being painful, yeah, he's being honest. It sucked. All right. I don't do lats very often on this channel because not many people really need it. But him being a climber, we're fortunate today for that. So yeah, basically, I hurt Phil until he felt better. That was the game plan for today. Going forward, fortunately, you have a very good base understanding of rehab sciences. Okay, and that's because of your education in kin and your hopeful acceptance into not physiology, physiotherapy program. Yeah, sorry, I can't speak to that. Okay. And you're also very active, okay, and that's great. Okay, when you're active and you're young, you will carry those habits with you into your adulthood, and that's going to serve you well throughout your life.
Absolutely.
Manual therapy-wise, I'm under the impression that you haven't done that much, okay, and that's okay. All right, you're a student. Okay, students, they do have benefits, but this kind of stuff is expensive. That being said, how old are you now? 25? 25. Okay, 25 is usually the age. Now, maybe not for you because you're healthy as an ox, but 25 is usually the age when people start to get their very first aches and pains.
Yeah.
All right. For me, when I turned 25, I got a bad knee out of nowhere. Now, I can rehab it. I'm okay because I know what I'm doing. But manual therapy comes in to help during those kind of plateau positions. So with this neck pain, absolutely, this is something we can get under control. It's not a serious complaint. It's going to be easy to fix. Why? Because you're healthy and because your practitioners know what they're doing.
Yeah.
Okay. Do you have any other questions for me for today, or anything you want to ask before we can sign off for today?
No, I have nothing left.
Awesome.
Well, thank you.
Thank you for coming in. It's very appreciated, and I'll see you next time.
Yes,
Phil.
sir. Yeah. Guys, don't forget to like, comment, share, and subscribe.
Thank you so much, Phil.